China reports 1,000 new cases of foot and mouth disease, raising global alarm over potential agricultural crisis. Date: February 6, 2025. Summary: China's recent report of 1,000 new cases of foot and mouth disease (FMD) has sent shockwaves through the global agricultural community, raising urgent concerns about the country's livestock health and the potential ramifications for food security worldwide. As FMD is a highly contagious viral disease affecting cloven-hoofed animals, the implications of this outbreak could extend beyond China's borders, potentially destabilizing the global meat supply chain. Current outbreak. The rise of FMD cases to 1,000 underscores a critical moment for China, which is a major player in the global livestock market. The disease, known for its rapid spread among cattle, sheep, and pigs, has prompted fears of severe economic losses, particularly in regions dependent on livestock farming. FMD can lead to the culling of infected animals, trade restrictions, and increased prices, ultimately affecting the availability of meat products in both domestic and international markets. Epidemiological context. The current FMD outbreak in China has drawn parallels to previous viral disease outbreaks, including hand, foot, and mouth disease (HFMD) in children, which has seen increasing rates in certain regions. Although HFMD primarily affects humans, the rising trend of enteroviruses, including FMD, indicates a broader shift in the epidemiological landscape that could inform public health responses. Studies in areas like Junyi, China, have noted significant increases in enterovirus infections, highlighting the interconnectedness of animal and human health. Global agricultural impact. The implications of the FMD outbreak are far-reaching. Given China's significant role in the global meat supply, the disease could disrupt trade flows and lead to food shortages in countries reliant on Chinese imports. Price volatility is another concern, as the culling of infected livestock and subsequent supply chain disruptions could drive prices up, placing additional strain on consumers and businesses alike. Countries that import meat products from China may need to reassess their supply strategies and consider alternative sources to mitigate potential shortages. This situation emphasizes the vulnerability of global food systems to localized outbreaks, further illustrating the importance of robust monitoring and response mechanisms. Preventive measures and response. In response to the outbreak, Chinese authorities are expected to implement enhanced biosecurity measures and vaccination protocols. The effectiveness and coverage of existing vaccines will be critical in controlling the spread of FMD, but their adequacy remains under scrutiny. Continued research and development in vaccination strategies are necessary, not only for FMD but also for other enteroviruses that pose risks to both livestock and human populations. The Chinese government is likely to collaborate with international health organizations to monitor the outbreak and assess its potential spread beyond national borders. This coordinated effort will be vital in maintaining global agricultural stability and protecting food security. Global vigilance required. The recent spike in FMD cases serves as a reminder of the need for global vigilance in monitoring infectious diseases that can impact agriculture. The interconnectedness of public health and agriculture necessitates a collaborative approach to disease prevention and response. This includes sharing data, resources, and expertise among countries to effectively manage outbreaks and mitigate their effects on food systems. Timeline of events. Recent reports. The surge in FMD cases was officially reported on February 6, 2025. Prompting immediate concern among agricultural stakeholders. Historical context. Understanding the epidemiology of viral diseases like FMD and HFMD provides insight into the potential trajectory of the current outbreak. Current measures. Authorities are expected to enhance surveillance and vaccination efforts as part of their response strategy. Conclusion. The outbreak of 1,000 new cases of foot and mouth disease in China poses significant challenges not only for the nation's agricultural stability but also for global food security. The situation calls for a unified response from the international community to prevent further escalation and to ensure that the interconnected systems of health and agriculture remain resilient in the face of such outbreaks. Continued vigilance, research, and cooperation will be essential in navigating this crisis and safeguarding the future of food systems worldwide. This report highlights the urgency and potential ramifications of the FMD outbreak in China, emphasizing the need for immediate action and global collaboration to mitigate its impact. The report on China's recent outbreak of foot-and-mouth disease (FMD) raises several counterintuitive points regarding the implications of this agricultural crisis. 1. High contagion versus economic impact. While foot-and-mouth disease is known for its high contagion among cloven-hoofed animals, the counterintuitive aspect is that the economic impact may not be immediate for large-scale livestock owners. Instead, smallholder farmers who often have less access to biosecurity measures and vaccination may suffer first and most severely. This disparity in impact can lead to a more significant overall economic disruption in rural communities, which are often less resilient to shocks in livestock health. 2. Global food security versus localized outbreaks. The urgency of the outbreak may lead to swift international responses such as trade bans and heightened surveillance, which are typically expected in large-scale outbreaks. However, the counterintuitive observation is that localized outbreaks can disrupt global food security more significantly than anticipated. Countries that rely heavily on imports from China could face food shortages, creating a ripple effect that extends far beyond China's borders. The interconnected nature of global food systems means that local outbreaks can have disproportionate effects on global markets and food prices. 3. Vaccine efficacy and research needs. While it is expected that vaccination would be a straightforward solution to managing FMD outbreaks, the current situation highlights the limitations of existing vaccines. The effectiveness and coverage of vaccines are under scrutiny, which is counterintuitive, as many might assume that vaccines are readily available and effective. This indicates a critical need for ongoing research and development in vaccine strategies, not only for FMD but also for related enteroviruses that impact both livestock and human health. For public health versus agriculture, the outbreak draws attention to the interconnectedness of human health and agriculture, which is often overlooked in discussions about livestock diseases. The rising incidence of hand, foot, and mouth disease (HFMD) in children in regions like Zhejiang, China, illustrates that agricultural health crises can have significant public health implications. This connection may not be immediately recognized, as the focus tends to remain. The report detailing the recent outbreak of foot-and-mouth disease (FMD) in China, which has seen a surge of 1,000 new cases, raises significant concerns for agriculture both within China and globally. While many might focus primarily on the immediate implications for livestock and food security, several critical aspects of the report may be overlooked, each carrying substantial significance. 1. Epidemiological trends and cross-disease implications. One important yet often overlooked aspect is the connection between FMD and other viral diseases, particularly the rising incidence of hand, foot, and mouth disease (HFMD) in children noted in regions like Zhejiang, China. The report mentions that HFMD has shown a rising trend in infections, which highlights the interconnected nature of viral pathogens. Significance. Understanding the epidemiological trends in both FMD and HFMD may provide insights into how viral outbreaks can influence each other. This becomes especially relevant in regions where livestock and human populations are in close proximity. The rise of one virus may create conditions conducive to the spread of another, complicating public health responses and requiring integrated strategies for surveillance and vaccination. 2. Impact on global trade dynamics. Another critical point that may not receive adequate attention is the potential disruption to global meat supply chains. The report notes that FMD outbreaks necessitate culling and trade restrictions, which could lead to increased prices and scarcity, particularly in regions dependent on imports from China. Significance. For countries reliant on Chinese livestock products, the implications extend beyond immediate food security. they can destabilize local economies, impact international trade relations, and lead to increased food prices globally. Understanding these dynamics is crucial for policymakers, businesses, and consumers as they navigate the potential fallout from such outbreaks. 3. Biosecurity measures and vaccine efficacy. The report mentions that Chinese authorities are likely to enhance biosecurity measures and vaccination protocols in response to the outbreak. However, it also points out the scrutiny surrounding the effectiveness of current vaccines. Significance: the efficacy of vaccines against FMD is not just a matter of public health, it directly impacts agricultural productivity and economic stability. If existing vaccines are found to be inadequate, this could necessitate urgent research and funding for new vaccine development, which is a complex and time-consuming process. The report underscores the importance of investing in vaccine research as a long-term strategy to prevent agricultural crises stemming from viral outbreaks. 4. Global vigilance and cooperative response. The call for international vigilance and cooperation in monitoring the outbreak's progression is another vital piece of information that may be dismissed. The report emphasizes the need for coordinated efforts in surveillance and public health policies. Significance: in an increasingly interconnected world, diseases do not respect borders. The potential for FMD to spread beyond China into neighboring countries and globally makes cooperative surveillance and response strategies essential. This underscores the necessity for international health organizations to foster collaboration between countries for effective disease management and to mitigate risks before they escalate into more significant crises. 5. Long-term agricultural stability and food security. Lastly, while the report focuses on the immediate outbreak, it is crucial to consider the long-term implications for agricultural stability and food security. The report indicates that severe economic losses can be expected in agriculture dependent on livestock. Significance: beyond the immediate impacts of the outbreak, the long-term effects on food systems could lead to increased vulnerability in food security, particularly in developing nations that may lack the resources to cope with such agricultural crises. Policymakers must consider not only how to manage the current outbreak but also how to build resilient agricultural systems that can withstand future shocks from similar outbreaks. In conclusion, while the report primarily highlights the immediate concerns surrounding the outbreak of FMD in China, it is imperative to also focus on the broader implications, including epidemiological trends, global trade dynamics, vaccine efficacy, international cooperation, and long-term agricultural stability. These factors are interconnected and critical for understanding the full scope of the potential crisis and for developing effective responses that ensure both public health and food security. 1. Epidemiological significance and global trade impact. The recent surge of 1,000 new cases of foot-and-mouth disease (FMD) in China serves as a critical indicator of the potential for widespread agricultural disruption. FMD is a highly contagious viral disease that primarily affects cloven-hoofed animals and can lead to severe economic losses in the livestock sector. Given China's integral role in the global meat supply chain, the outbreak raises alarms regarding trade dynamics, food security, and economic stability across nations that rely on Chinese livestock products. The implications extend beyond immediate agricultural concerns, potentially affecting global meat prices and availability, underscoring the interconnectedness of agricultural economies. 2. Epidemiological trends and public health concerns. The analysis of related diseases such as hand, foot, and mouth disease (HFMD) indicates a broader trend of increasing viral infections in China. The rising incidence of HFMD in regions like Junyi highlights the evolving landscape of viral outbreaks, emphasizing the need for a comprehensive understanding of viral transmission dynamics. This epidemiological insight is crucial for anticipating potential future outbreaks of FMD and other zoonotic diseases, reinforcing the necessity for robust public health surveillance systems to mitigate risks. 3. Preventive measures and vaccine development. The outbreak necessitates an urgent reassessment of preventive measures, including biosecurity protocols and vaccination strategies. while Chinese authorities are expected to enhance these measures. The effectiveness and coverage of existing FMD vaccines remain in question. The ongoing research and development of vaccines are essential not only for FMD but also for other enteroviruses affecting both livestock and humans. The situation stresses the importance of investment in veterinary public health and the development of effective vaccination programs to prevent future outbreaks. 4. The global cooperation and response strategies. The international community's vigilance and coordinated response to the FMD outbreak are imperative for managing its potential spread. The need for collaborative efforts in surveillance research and public health policies cannot be overstated. Global food security is intricately linked to the health of agricultural systems, and a unified approach is crucial for addressing the challenges posed by zoonotic diseases. This situation serves as a reminder of the importance of global cooperation in public health and agricultural policies to prepare for and respond to emergent infectious threats effectively. 1. Foot and mouth disease in the United Kingdom 2001. The UK faced a severe outbreak of foot and mouth disease (FMD) in 2001, which led to the culling of millions of animals and significant economic losses for the agricultural sector. The outbreak began in February and peaked in March, spreading rapidly across rural areas. The government's response included strict movement controls and the slaughter of infected and potentially infected livestock. The crisis not only affected farmers but also had a profound impact on rural communities and tourism, as public access to farms in the countryside was restricted. Ultimately, the outbreak highlighted the vulnerabilities in livestock management and biosecurity practices. 2. African swine fever in China 2018. In August 2018, China reported its first cases of African swine fever (ASF), a highly contagious viral disease affecting pigs. The outbreak led to the culling of millions of pigs, disrupting the global pork supply chain and causing pork prices to soar. Given China's status as the world's largest pork producer, the outbreak raised alarms about food security and economic stability in the region. The Chinese government implemented strict measures, including quarantine zones and movement restrictions, to control the spread of the disease. The crisis underscored the interconnectedness of global food systems and the challenges of managing animal health crises. 3. Bovine spongiform encephalopathy (BSE) crisis in the UK 1990s. The BSE outbreak, commonly known as mad cow disease, emerged in the UK in the late 1980s and became a significant public health crisis throughout the 1990s. The disease affected cattle and was linked to a fatal human variant known as variant Creutzfeldt-Jakob disease (VCJD). The outbreak led to widespread culling of cattle, a ban on certain animal feed practices, and a profound loss of consumer confidence in beef products. The UK government faced intense scrutiny over its handling of the crisis, leading to changes in agricultural policy and food safety regulations. The BSE crisis highlighted the importance of biosecurity measures in preventing zoonotic diseases and the need for transparent communication with the public during health emergencies. Future outlook: predictions for the agricultural impact of China's foot and mouth disease outbreak. The recent surge in foot and mouth disease (FMD) cases in China, with reports of 1,000 new infections, has raised considerable alarm regarding potential agricultural crises both within China and globally. As the situation evolves, several predictions can be made concerning the future implications of this outbreak on agriculture, livestock health, food security, and trade dynamics. 1. Increased biosecurity measures. In response to the FMD outbreak, it is expected that Chinese authorities will implement stringent biosecurity measures across livestock farms. This may include enhanced monitoring of livestock health, stricter quarantine protocols for infected animals, and more rigorous inspections of livestock transport. These measures could lead to improved disease management practices in the long term, although they may also initially disrupt normal operations within the livestock sector. 2. Economic impact on the livestock sector. The economic repercussions of the FMD outbreak could be severe. Farmers may face significant losses due to the culling of infected animals, reduced herd sizes, and decreased productivity. The livestock industry. particularly in regions heavily reliant on cattle and pig farming, could see a downturn. In the short term, this may lead to increased meat prices and potential food shortages within China and in countries dependent on Chinese meat imports. As a longer-term consequence, there may be shifts in market dynamics, with some farmers pivoting to alternative forms of agriculture or diversifying their livestock to mitigate future risks. 3. Global supply chain disruptions. Given China's critical role in the global meat supply chain, the FMD outbreak is likely to have ripple effects across international markets. Countries that rely on imports of Chinese meat products may experience supply shortages, leading to inflation in meat prices globally. Trade restrictions imposed by other nations in response to the outbreak could exacerbate these shortages. As a result, countries may seek to diversify their supply sources, potentially reshaping global trade relationships in the agricultural sector. 4. Investment in vaccine development. The outbreak may catalyze increased investment in research and development for FMD vaccines. While current vaccines may not provide complete coverage or effectiveness against all strains of the virus, future innovations could lead to more robust vaccination strategies. The urgency created by the outbreak could accelerate partnerships between governments, research institutions, and pharmaceutical companies, fostering advancements in vaccine technology that could benefit both livestock and public health. 5. Epidemiological monitoring and surveillance. Enhanced epidemiological monitoring and surveillance systems are likely to be established to track the spread of FMD and related diseases. This may include improved data collection methods, real-time reporting systems, and better communication between governmental and agricultural stakeholders. Such initiatives could lead to early detection of future outbreaks and more effective containment strategies, ultimately bolstering overall agricultural resilience. 6. Shifts in consumer behavior. As awareness of livestock disease outbreaks increases, consumer behavior may shift. There could be a growing preference for locally sourced meat and a decline in demand for imported products perceived as higher risk. This trend may encourage the development of local agricultural markets and foster sustainable practices that prioritize biosecurity and animal health. 7. Long-term agricultural policy reforms. In light of the FMD outbreak, it is anticipated that agricultural policies in China and other affected regions will undergo reform. Policymakers may place greater emphasis on biosecurity, disease prevention, and sustainable agricultural practices. This could involve increased funding for veterinary services, better training for farmers in disease management, and the promotion of practices that reduce the risk of disease transmission in livestock. 8. Global collaboration in agricultural health. The outbreak of FMD in China could spur greater international collaboration in agricultural health. Countries may recognize the interconnectedness of food systems and the need for coordinated responses to infectious disease threats. This collaboration could manifest in shared research initiatives, joint training programs for farmers, and unified strategies to combat future outbreaks, enhancing global food security as a result. In conclusion, the recent rise in foot-and-mouth disease cases in China presents a multifaceted challenge with significant implications for agriculture and food security. The predictions outlined above highlight the potential for immediate and long-term changes in agricultural practices, economic dynamics, and global trade relationships. As stakeholders respond to this outbreak, a concerted effort will be necessary to mitigate risks and ensure the resilience of the agricultural sector in the face of evolving challenges.